Hello everyone, my name is Norm Thurston. I'm a state representative from House District 64 and I live in Provo. I'm here today to talk to you about House Bill 207, Insulin Access Amendments. This is a bill that I've introduced into the Utah State Legislature and that we need to get passed this session. In Utah today, there are 50,000 people who need insulin to survive, and 1 in 4 of them does not take as much insulin as they really should take to carefully manage their diabetes. And that's a problem because if you don't take as much insulin as you're supposed to take, it can lead to ketoacidosis, kidney failure, blindness, and even death. Last year, T1 International, a local advocacy group, held a vigil to honor 12 Utahns who died because they didn't take enough insulin. What are the reasons why people are not taking enough insulin? The first one has to do with cost. For a typical diabetic, the cost of insulin can easily reach $2,000 a month, and you can see how that could put a strain on any family's budget. The second one has to do with administrative issues related to your prescription. Sometimes people show up at the pharmacy and their prescription has expired, they have no refills, or if it's just for the wrong thing, and the pharmacist has no option but to tell you go back and talk to your doctor. In the meantime, bad things can happen. And this shouldn't happen today. While 100 years ago, if somebody was diagnosed with diabetes, it was essentially a death sentence. There was nothing that could be done. But in 1921, Canadian scientists discovered how to extract insulin from animals, and that insulin could then be injected into people with type 1 diabetes. Today they live long, healthy, normal lives. But the problem has to do with cost. Let's talk about cost for a minute. In the beginning, insulin cost 2 cents per unit to produce. Today, in the last 10 years, it has gone up over 300% to over $275 or $300 or $350, depending on the type of insulin, for one vial. That's not acceptable. We need to find a better way to make this available to people who need it to survive. So House Bill 207 brings to bear some really important principles to help make it affordable and accessible to more people. The first provision in House Bill 207 is that insurance companies will be required to offer a low-cost or no-cost solution for people with type 1 diabetes. That will significantly drop the price to those who are struggling to afford it. For those who are not able, who are not covered by a plan that's affected by this legislation, or who otherwise don't have any coverage at all, there's a second option. You can participate in the Public Employees Health Plan bulk purchasing program. Right now, the state of Utah buys insulin for our members. We get about a 75% discount. We can extend that discount to everyone who lives in the state. And that's not a perfect solution, but it's a whole lot better to pay 75% less than what people are currently paying. The third provision of the bill would allow pharmacists to make changes to people's prescriptions on an emergency basis to make sure that they leave the pharmacy with what they need to survive. If this bill passes the state legislature and signed by the governor, no one in the state of Utah will ever need to leave a pharmacy without the insulin that they need to properly and carefully manage their diabetes, which should result in 0 deaths due to insulin inadequacy. Thank you for your time.